Now we go on to the star himself, Sri Ganesh, a star in ophthalmology, star outside of it too. Over to you, Sri Ganesh. He has shown us a lot of heroics, but today he's going to show something very simple and relevant.
Yeah. Thank you, Dr. Chitra and Dr. Ramurthy and ARC for inviting me to this webinar. There are many situations like you watched post-polar cataracts, PC dehiscence, where you may have to inject a three-piece lens. And these are situations where you may have not used these lenses and you don't know how to handle them. And many of my colleagues were, in fact, they struggle with it, or they asked me, why don't you make a video on this? And that's what I'm going to present today, how to properly load and inject a three-piece lens. And let's play the video and I'll explain it. It's a simple video. So I'm using a Sensor three-piece lens, which I think a lot of people commonly use. So you can see that this has a template on the flange of how you have to place the lens. And here you can see that is the three-piece lens. If you place the three-piece lens on top and try to push it in, sometimes it does not go in. So many people try this. The lens is quite stiff. So you have to ideally slightly fold the flanges and then insert the lens from behind into the groove. See, this is how you do it. After putting viscoelastic, of course, into the cartridge, and then you place it in orientation to the template picture on the flange. After that, you press down with a MacPherson. You press the lens down with a MacPherson, and then you fold the flanges. And once you fold the flanges, you will see that you will have to check the orientation of the haptics. And you can see the orientation of the haptics. It should be downwards. You can see the trailing haptic and the leading haptic are downwards, like a handlebar mustache. So that is the correct way. And after that, you can put it into the screw type injector, the emerald injector that you see there. And when you put it onto the injector, you will have to see that the trailing haptics is over the rail of the injector. You can see that it's over the rail there. You can see it in the picture. And that is the correct method. Then you just press on the plunger so that it comes to a stop, and then you start screwing it. You can see the leading haptic come into the cartridge. Then, of course, after you put in viscoelastic, the orientation of the flange is very important. It has to be beveled down, and the flange there has to be towards your right. You can see the flanges are directed towards your right, and then the bevel is down. And then you can enter with a screwing motion. So a couple of twists, and then you can very easily enter into the 2.8 mm incision. And once you have entered, then you start injecting. As you are injecting, once the haptic comes out into the capsular bag or the sulcus, wherever you're putting it, you will have to rotate. You rotate the injector so that the flanges, you can see, come vertically. And the bevel is sidewards, and then the lens opens up. It does not tumble. This is especially important when you are inserting the lens when you have a PC rent. If the lens suddenly tumbles, the lens can go into the vitreous. Then you withdraw the plunger and then again rotate it so that the flanges are onto your right. And then you engage the plunger, you engage the trailing haptic with the plunger, and then start screwing. So the haptic is towards the right and your bevel is down, and then you can easily insert the trailing haptic in one go. So you can see that the lens is centered well, and that is the correct technique of loading and injecting a three-piece lens. So I thought this is a simple video, but it would be useful for most of my colleagues.